This presentation gives you information that is specific to our organization when using ESO. You can sign in on either the web browser by going to esosuite.net on any device, or you can use the mobile app on the truck computers. You can use the ESO Suite EHR mobile app without an internet connection. We will go over the use of the mobile app first. At the beginning of every shift, enter your username and password, then click on the refresh button and update system data. When the system data is updated, click OK. Then let's go. On your dashboard, you can set your shift. This will fill in the crew and truck information in every EHR you start. You can click New Record to start a new EHR from the dashboard, or from the Records tab. We will enter the prefix of HCYY for year before our incident and run numbers. For example, this year it would be HC24. Be sure to enter roles under the Personnel section. Only select one role. For scene runs, select Lead at Scene for the primary caregiver and select Driver, Response for the driver. For transfers, select Lead Transport for the primary caregiver and select Driver, Transport for the driver. Your third crew members, students, etc. can be entered as Other Caregiver or Other. Be sure to put a reason other than patient's choice for your transport. Due to section. Example, if the patient is having chest pain and wants to go to Floyd, select Regional Specialty Center. Example, you are transporting a trauma to U of L, pick Protocol or Regional Specialty Center. You can search for a previous patient on either the mobile app, select and import the patient data, or in the web browser. Web browser can also pull hospital data, longitudinal record, in addition to our records. Once you select the patient data, it will import everything to your EHR, including history, medications, and allergies. Be sure to add belongings as this can save you in the event of a missing item. Cardiac monitor data can now be transferred over the cloud. This should be the primary way we transfer data. On the monitor, you want to select the Log button. You will then want to select the white envelope. It will ask you if you want to close the current case or continue. Click Continue. You will then select the cases that you want to upload to the cloud. Then hit the Home key. Then move to Transfer and hit the Enter key. You will then see this screen as the cases are uploading. When complete, you will get this message. Your cardiac monitor data is now on the cloud and ready to pull down to your EHR. Then on either the mobile app or in the web browser, you can click Monitor Import. Select Cloud. Select the case you want to import, then click Import. We will also walk you through the other ways to upload cardiac monitor data, although you should not have to use the following ways as long as the cloud is working appropriately. You can also transfer the files like we used to do on the Zoll program, but this must happen on the mobile app prior to syncing your run. Once a record is synced, it cannot be sent back to the mobile app. Cardiac monitor data transfers easily over Wi-Fi. Select Wi-Fi. Select the case you want to transfer and click Import. Click OK when done. Cardiac monitor data can also be transferred by USB. Select the file from the USB drive you want to transfer. Select the case you want to import. Click OK when done. There are some areas that are different than Zoll that may cause some confusion. You can document your blood glucose under vital signs. How you obtained it can be added to your narrative. On the flowchart, 4-lead ECG and 12-lead ECG are under the Other tab. They are at the top of the list, as they are some of the most used. Blood draw is not for blood glucose. It is for an actual blood draw. If the insurance carrier isn't listed, click Other Insurance. When you do that, other fields will populate below that line. Remember that the program is adaptive. As you select items, some items will appear or disappear. Signatures can be obtained on the EHR or on the pre-hospital assessment sheet. Provider signatures are required at the end of every EHR that you complete. This is different as they view each EHR as a legal document, and you must sign each document instead of just once during your shift. Our agency ID is HCHEMS1. You will need this ID to sign in on the web browser. Any messages you receive for corrections on runs will be on this homepage, as well as under the Agency Alerts and Messages tab of the mobile app. Any messages you receive for corrections on runs will be on this homepage, as well as under the Agency Alerts and Messages tab of the mobile app. If you have any other questions, please do not hesitate to reach out.